Welcome, everyone. All participants have been muted. If you have any questions or need technical help during this call, please utilize the chat function in the bottom right corner of your screen. You can also private message me, Desiree Smith, or Leandra Lacey, who is serving as our technical assistants. We are listed as a host. All questions for presenters will be addressed at the end, but we will keep a queue, so please send them our way as they come up. This webinar is being recorded. The recording and presentation will be placed on the NTSC website after the webinar. Hello, everyone, again, and welcome to Still Preventing. My name is Desiree Smith. I am the Health Equity Manager at the National Coalition of STD Directors, and I'm joined by my colleague, Leandra Lacey, NTSC's Associate Director of Capacity Building and Member Engagement. She will be facilitating the technical assistance, as I previously mentioned. For this webinar, we are considering all the challenges that we've experienced through COVID-19 pandemic, as it has thrown STD programs in a little bit of a disarray at first, but we're still, of course, preventing STDs and HIV. Join us as we discuss condom distribution, self-collected at-home testing, and PrEP access, especially for MSM. We will also explore lessons learned in meeting men who have sex with men sexual health prevention needs during COVID-19. Some of the goals that we have to focus attention on today are, like I said, condom distribution, at-home testing, PrEP initiation and retention, and then, of course, STD clinical adjustments and telehealth. With that being said, I would like to welcome our first presenter, Juan Loubriel from Whitman Walker Health.
Good afternoon, everyone. Thank you for having me. My name is Juan Carlos, and I am the Director of Community Health and Wellness at Whitman Walker Health. And I will give you a quick background if you don't know who we are. So we are a federally qualified health center in the District of Columbia, and our mission is to offer affirming community-based health and wellness services to all, with very expertise in the LGBTQ and HIV care. And we empower all persons to live healthy, love openly, and achieve equality and inclusion through multiple locations throughout the city. At-home HIV testing pilot, I will provide a little bit of the background first. In mid-March of 2020, as the pandemic started unfolding, Whitman Walker Health decided to open 2 respiratory clinics at both health centers. We also switched in-person care to a telehealth care model right immediately after we closed for in-person services, and we decided to quickly create a pilot for at-home HIV testing. And this was prior to DC Health starting to implement their at-home testing program. And the purpose of this pilot was to safely provide HIV testing services to our most vulnerable population during the COVID-19 pandemic. And we wanted 2 things. One, to provide a seamless linkage to Whitman Walker Health prevention and treatment services to clients, but also we wanted to build a rapport with our clients' population during these unprecedented times of the COVID-19 pandemic, and assess and address clients' needs. Our testing program have a lot of repeat testing clients normally, so all clients receiving services at Whitman Walker are entered in our electronic medical record. So how we decided to do is we, with the help of our Population Health and Quality Department, we created a query from eligibility criteria that we established for the pilot. So those were clients living in the district in wards 5 through 8 and had a positive STI result in the past. In the first initial call, the counselor explains the process and offers the test. And if the client agrees to receive the test, a follow-up appointment to conduct virtual testing and counseling is scheduled. We provided contactless delivery through by a member of the community health department. And the package included condoms, lubes, inserting condoms, and the oral swab kit. And then during the virtual appointment, the counselor explains how to use the test, and the client is instructed to conduct the test right there virtually. And while the test is running, the counselor provides client-centered counseling. At the end of the session, if the result was reactive, the client was linked through our red carpet telehealth virtual red carpet services. We had a total of 20 clients. 18 were non-reactive. 2 did not self-report, and I wanted to make a point here. When we were searching and looking at different programs throughout the country at home testing, as we learned from multiple jurisdictions and states at home testing programs, they all had concerns about client self-reporting. So we did have 2 not self-reporting. 4 of them were linked to Whitman Worker Health Services, such as PrEP and insurance navigation. 16 were MSM, 4 female identified, and 3 youth. So lessons learned from the program. Clients were very appreciative of us providing needed free testing services in the comfort of their home. However, even though clients were very appreciative about the service, our clientele prefers in-person appointments. Also, having a team who can quickly answer questions and provide support, it is very important. We did reopen in-person testing and treatment services by appointment only and are still offering at-home testing. However, since we started offering in-person services, clients prefer this method than at-home testing. And for coordinating at-home kits for youth, oftentimes presented challenges for them because they were really concerned about their parents might see the kit. So to accommodate youth, we provided curbside pickup. So also to better serve clients who frequently seek services at our free sexual health clinic, we launched at-home STI testing in partnership with LabCorp. At-home testing also allow providers to order a home kit for our patients as well as our PrEP clinic. Clients basically are screened over our STI hotline, offering a client-centered approach, and the kit was mailed via USPS. We work with LabCorp to identify 3 convenient facilities for our patients throughout the city. So we cover Northwest, Southeast, and Southwest, and Northeast, I should also say there. And then currently, LabCorp does not allow conducting swab at their facilities. So clients will have to collect their samples at home and bring it back to the facility that they have chosen. And clients can select one of those 4 locations to drop off the samples and complete the blood work. STI treatment is coordinated. If one of the STI was positive for one of the STIs, it's coordinated in-house through our sexual health clinic by appointment. We were able to reopen the sexual health clinic by appointments only, and it also still offers at-home testing. And once again, at-home testing requests have declined since we are reopening services. And unfortunately, our Population Health and Quality Department has not finalized data analysis for the program, so I won't be able to share any findings today. Our PrEP clinic, I'll provide you a quick background. In 2018, we launched the PrEP clinic, which is a specialty clinic where non-medical PrEP specialists provide PrEP follow-up visits care under the supervision of the patient's primary care provider. It is also a place where dedicated PrEP clinic support staff provide concierge-level services to PrEP patients enrolled in the clinic. So basically what this does is quarterly visit, includes all necessary elements of PrEP follow-up for visit per CDC guidelines, and those include the rapid HIV test, adherence, HIV and other STI prevention and counseling, screening for acute HIV infection, collection of all necessary lab work, and dispensing the actual medication. So all the appointments consolidates the medical, phlebotomy, and pharmacy into one appointment, expedited appointment within 20 minutes, guaranteed. Patient can opt out from this program and can be seen by their primary care provider. So in March 2020, in-person appointments were canceled as the pandemic was unfolding. PrEP clinics patients will transition our PrEP clinic patients services to a telehealth model. And during that first closure, prescription were extended for 90 days without labs while we were implementing at-home STI testing. During those 90 days, patients were receiving virtual check-ins every 30 days for adherence. In April, we implemented our teleprep model, including at-home STI testing. In September, the PrEP clinic reopened in-person visits, and it is still offering teleprep services. On the left, you will see this table details numbers of teleprep and physical PrEP appointments the clinic has conducted from the onset of COVID-19 to February 2021. And please note that these numbers represent appointments alone, no unique patients. So for example, if you're looking at April and May together, it may be possible that two of those appointments are with the same patient, as the team was conducting 30 days follow-up at that time. On the left, this sheet compares the number of new PrEP prescriptions written in the previous 12 months from both February 2020 and February 2021. So what it means is it examines the number of new PrEP prescription written between March 2019 and February 2020, and makes a month-by-month comparison of those written between March 2020 and February 2021. And what you see to the right is these time frames are very helpful because they show the month-by-month impact of COVID-19 on new PrEP initiation at Whitman Walker. And indeed, new PrEP prescriptions written between March 2020 and February 2021 track with the COVID-19 positivity rate in our respiratory clinic at Whitman Walker. Also, our PrEP clinic currently has a total of 1,039 patients, and to ensure all patients enrolled in the PrEP clinic were maintaining their quarterly follow-up appointments, the PrEP clinic team began conducting re-engagement calls in October 2020. How we did it is data compiling appointments records from December 2019 to October 2020 were used to determine which patients needed to be contacted. We found a total of 415 patients were identified through this method, and what you can see here are 79 of those were disenrolled from the program. On the right, you will see reasons why. For example, the first one is moved out of the DMV, 27 patients moved out of the district, changed from PrEP care provider. I will point it out the personal decision to stop PrEP is a count of 18, but out of those 18 disenrolled for stopping PrEP, 9 patients reported stopping due to being in a monogamous relationship, and 3 patients reported stopping due to minimal to no sexual activity during COVID-19. And 6 of them didn't disclose the outcome for it. I will now provide you a quick background of our social media outreach. Whitman Walker Health started expanding its outreach efforts pre-COVID to include social networking technologies to deliver information about sexual health, HIV prevention, and any general health to its priority populations. We utilize various social media platforms such as Facebook, YouTube, Twitter, and Instagram to execute weekly educational discussion centered on access to Whitman Walker Health's preventative services. The sessions are facilitated by Whitman Walker Health community health educators, medical providers, and social media influencers. So these influencers are peer advocates who have at least 500 or more followers in their social media and are trained by Whitman Walker Health staff. Those facilitate and they become facilitators. They are recruited who they represent the key populations and have experience in both social media and community outreach to build trust with members of the priority populations. Also, while promoting and raising awareness around our services and various sexual health topics, the platform also allows users to share their own experiences. It also enables Whitman Walker to improve its target outreach and efforts. And during COVID-19, we launched a diversity and inclusion efforts where we contacted and started conducting more live Instagram lives with content has been expanded to target and engage many different audience. We started collaborating with different local partners such as Planned Parenthood, Delta Sigma, and Latin American Youth Center, and others. These are some of the topics that we have provided via Instagram Live, such as COVID-19, of course, updates, Q&A, vaccine, a lot of questions, Black women and HIV, wellness, meditation, mindfulness, in those types of services. On the right, you will see samples of our postings. Talking about the influencers, these individuals are our current influencers. They are passionate about being an advocate in the community, and they do this work just as a part-time while holding a full-time job as well. You will see here more of the infographics and in posting. From U equals U to the vaccine to how to get tested at Whitman Walker and other type of information. And how we measure impact? Overall, we are seeing a new followers on social media. The growth rate has exceeded all of our goals and expectations across all platforms. And you can see infographics and COVID vaccine experience posts actually are achieving the greatest engagement and reach. And you can see the comparison in both tables, the followers versus the reach here. And in a closer look here, you will see a big increase in impact on Instagram, actually live. How is one of the largest increase. Also noticeable in LinkedIn. We were not very active in LinkedIn, and now they start growing a lot of followers and reach in that media platform. And with this, I'll conclude with my presentation. Thank you so much for attending, and I welcome any questions. Thanks.
Thank you so much, Juan Carlos. Up next, we have Antonio and Carlos from Howard Brown Health.
Hi, everyone. Thank you for joining us today. My name is Antonio Elizondo. I use he, him, they, them pronouns or anything respectful, and I also go by Tony. I'm the manager of Sexual and Reproductive Health Outreach Services here at Howard Brown Health.
Hey, everyone. My name is Carlos Fragoso. I go by any and all pronouns with respect, and I am the coordinator of the Sexual and Reproductive Health Outreach Services here at Howard Brown.
A little bit about myself. I'm 28. I reside here in Chicago, Illinois. As I stated, I'm the manager of Sexual and Reproductive Health Outreach Services. I started a little bit of activism and some domestic violence work in Pilsen here in Chicago. Later moved on into HIV-focused work. I was a part of a couple national campaigns with the 25 under 25 Greater Than AIDS campaign, as well as the CDC is doing a campaign. In 2016, I joined Howard Brown, and it's been a really great journey. I love it here. And I've been able to manage the Sexual and Reproductive Health Outreach team that provides HIV and STI screenings in Chicago, Illinois, and suburban Cook County. We do this all while promoting that the community members are advocates of their own health.
Hi, everyone. My name is Carlos Fragoso again. I started my work in community health in 2016, running an intervention called Empowerment at Vida Sida in Humboldt Park. Since then, 2017, I also helped with an emerging model that went on to be presented at the United States Conference on AIDS, using drag for HIV prevention services. Also been a part of the Association of Latinx Motivating Action, which is ALMA, an advocacy program, and education for fighting for the rights of Latinx queer community. And now I'm here since 2018 with Howard Brown Health. Started as a health educator, and now I am the coordinator helping with facilitation of the HIV screening and counseling certification trainings, offering screening services, and now coordinating the at-home prevention program.
Perfect. Thank you, Carlos. Before we begin the presentation today, we want to acknowledge that everyone has been working through some extremely stressful conditions over the past year, but it's in times like these that we rise up together and we reach a common goal. And so we want to acknowledge that we've all been doing great work day in and day out, keeping our communities healthy, and that self-care is key, so make sure you're taking care of yourselves. A little bit about Howard Brown Health. Howard Brown Health is located in Chicago, Illinois. Our mission statement is that Howard Brown exists to eliminate the disparities in healthcare experienced by the LGBT people through research, education, and provision services that promote health and wellness. Howard Brown is made up of 7 major programmatic divisions. This includes primary care, behavioral health, research, HIV/STI prevention, youth services, elder services, and community initiatives. A little bit more about Howard Brown Health. We had some quick expansion over the past 5 years. In the past 5 years, Howard Brown expanded to the south side, where we opened a few different locations like 47th, 55th, and 63rd. We also on the west side opened up La Casa Norte, and so it's been really great to see the clinics expand from 13 to 14 over the Chicagoland area. Also in 2019, to highlight, we had launched some express clinics, and these express clinics focused on HIV and STI testing. And so it's a free HIV and STI testing program where any client can walk on in and access those services. As the COVID-19 pandemic was kind of upon us and we started receiving guidance and restrictions to implement some physical distancing, we came up with a few different initiatives to respond to this. One of the initiatives that we came up with were community care tents, like the one you see pictured here, where it would be paired up with some providers and some MAs and different folks who could provide screenings for COVID-19. This has transitioned, and we've been able to now do COVID-19 screenings that are self-swabs, and so they look a little bit different with bunkers, but the same concept was implemented. We worked with several community partners to implement these tents, and that was really exciting because the community already had trust with us, and so they were able to come and receive these services with us in lieu of not having access to some other services at this time. We had pulled back and tried to transition into some telehealth services. So we moved our primary care to telehealth. We started doing behavioral health, psychiatry, dentistry, case management, health education, and different support groups over telehealth in the time. We still are doing most of these services in telehealth, but we have offered limited services at some of our clinics. Another more recent response that we've been doing to the COVID-19 pandemic is our immunity relay events. Recently, Howard Brown held 3 large community immunity relay events where we did COVID-19 vaccinations. And so within the first 2 events, we were able to vaccinate 4,000 folks in Chicago. In the next event, we did about half of that through a smaller initiative with our clinics. So it's been a really exciting time to be able to respond to the pandemic. Alongside a lot of these initiatives, we launched our at-home prevention program, which we'll be focusing on today. As I mentioned, Carlos and I are leadership within our sexual and reproductive health outreach services team. And so recognizing that we had to pull back from being in physical spaces and community, we wanted to still reach our clients in a way that we recognized that they would be comfortable with. And so we adapted our outreach methods to focus on online services during the beginning of the pandemic. And now, more recently, we've been doing a little bit more in-person services, and so Carlos and I can speak to that in a little bit. Like I said, today we're going to be focusing on the HIV and STI screening that happens at clients' homes, and then the prevention supplies mail delivery program.
Yeah, so just a little bit about what traditional outreach used to look like. Our team pretty much held regularly testing sites throughout the city of Chicago and the suburban Cook County, and this includes offering a full panel HIV, gonorrhea, chlamydia, and syphilis screenings in the community. Since the COVID-19 pandemic started, we did have to halt in-person services due to an array of precautions that were happening at the time. Since then, we have actually resumed at one of our sites. We wanted to highlight this because we implemented new strategies to make sure that we were keeping clients and staff safe. So that includes screening for COVID-19 symptoms at the door, any kind of exposures or recent exposures, and along with a temperature check. This is followed by a newly introduced electronic registration method that collects all the information that we need for our funders and for just in general providing client-centered care. That has assisted in also the online registration to also include consent forms. So we can talk about technology in a bit, but we use Helpvana, which allows us to get those consents from patients electronically, reducing the amount of paper back and forth that's happening. And we're also providing all staff and anyone coming into the lobby spaces with personal protective equipment, masks, hand sanitizers, and things of that sort. And so we've noticed that through this adaptation, we've been able to shorten sessions in person and kind of be more direct with how we're offering our risk reduction counseling services during this time of COVID. And so one of our responses to the pandemic includes the at-home prevention program, which was one of our, it's like a baby program that grew within the team that's listed here. And so we did want to highlight the staff listed because it wouldn't have been possible without everyone's support here. And so some dates to highlight at the onset. We were offering the OraQuick at-home HIV screening test at the beginning, which launched April 13th of 2020. Our ordering page went live. That included the prevention supplies of condoms and lubricants. We increased our data collection questionnaires in May, and then in July we added some face cloth mask and safer injection kits to be requested. And then in September 2020, we moved from offering OraQuicks to partnering with My Lab Box, which extended the HIV and STI screening services to include a full panel of gonorrhea, chlamydia, and syphilis, and a 4th-generation rapid blood spot card. So we can talk a little bit about that in detail. So here we have some supplies listed of what is available. As mentioned, My Lab Box really helped us to expand what kind of services people were receiving at home. This We still continue to offer condoms and lubricants, including, the very costly receptive partner condoms and the latex-free condoms. Those are all available for ordering. Lubricants, water, and aloe and silicone. We did have to discontinue the safer injection kits because we were not listed with the United States Postal Service as a quote-unquote registered agent to send drug paraphernalia in the mail. So we did have to discontinue that, and we're going to look into the future of how we can work to provide those services. Along with all of the kits that are sent out, we have an insert that talks about sex and COVID-19, some of the precautions to take and things to keep in mind, along with instructions of how to conduct the test kits that are being requested, and any other handouts that are requested. And so here we have a little bit of a breakdown of the flow that goes with when it comes to ordering supplies. So we receive the patient will order through our data collection form called Smart Sheets. The health educator will then review all the information to make sure that Smart Sheets and Healthvana are matching, so the addresses, phone numbers, things of that sort. The health educator will review the profile has been created and consents are completed. If there's any kind of mistake or any kind of follow-up that we need to do, we'll go ahead and contact the patient just to confirm that we have a correct shipping address, if there's any discrepancies. Once the health educator confirms all the information, they will then place the order with our MyLabBox portal. Once the order is placed, the patient will have their collection kits sent to them within 2 business days. The health educator will then email the patient with the risk reduction and safer sex packet along with the instructional inserts. Once the patient receives their kit, they will conduct a self-swabbing and self-collection, package everything with the provided mailing information and a lab requisition form. Once the lab processes the results, we will be notified first. So any negative results, we will automatically upload them into their Healthvana profile, and they'll be able to see that instantaneously. If any positive results have come back, we follow our model of contacting the nursing team or linkage to care to connect the client for treatment and care. And then once the patient receives contact via phone, we'll schedule them in for treatment if needed, and follow up that way.
We recognize that the slide might be a little bit difficult to read, so if you have questions, definitely please feel free to throw them into the chat box. Moving on to our next slide. So to dive into a little bit of the technology we use, like Carlos said, we rely heavily on 2 platforms, one being Smart Sheets and the other being Healthvana. Smart Sheets is a really great form collection data tool. It's similar to like Google Sheets if you use that as an online platform. One of the benefits is that we've been able to buy a HIPAA-compliant version of Smart Sheets, and it does come with templates to create online forms. And so we've been able to adapt kind of like what a registration form would look like in person into something that would be done digitally. The other thing is that us having the liberty to be able to adapt this on our own, we're able to do an English and a Spanish version, and that was pretty easy to manipulate as well. So Smart Sheets is the first data collection tool that we utilize to collect anything with risk assessment questions, what clients would like to order, their demographic information, etc. So that would be Smart Sheets. Our second platform that we utilize is Healthvana. And so with Healthvana, this was a platform that we were already using in our Express model clinic, and also we started implementing into our walk-in models. And so Healthvana creates a client chart that can synchronize with our electronic medical record system, which at Howard Brown we use Centricity. And so the patient charts and Centricity are able to sync with the Healthvana charts. Once clients complete their charts, they're also asked for consents for services. So this is really great because we're able to collect electronic consents versus having to rely on paper documentation. Another benefit to using Healthvana is that it has a messaging system where you can interact between service provider or health educator and client, and so you're able to message on a HIPAA-compliant platform, and clients receive these messages instantaneously. Another benefit to Elvana is that it helps us with the result delivery, and so we're able to do electronic result delivery. Like Carlos said, if the results come back as positive or reactive, we would go ahead and connect with them first as a nursing team or a treatment providing team before we move forward with sending them the results through this platform. If they're negative results, then clients can get them as soon as we receive them, and we'll upload them there, and they'll receive a notification that they were sent over. Additionally, we created an email and a phone number so that clients can go ahead and contact us via these methods. It's been great benefit to have both of these services. Clients definitely reach out across all of these different contact ways. So we get a lot of messages through Healthvana. It's also how we do follow-up if we're waiting on clients to send in a kit or do something like that, maybe follow up with consent. And then we also have the phone number, and clients do sometimes call with questions about how the test kit is utilized or how they can go ahead and when they can process it. Maybe they want to come back at a later date. Moving on to our partnership with My Lab Box. My Lab Box is a third party that ships out our screening and specimen collection kits. And so through our partnership with My Lab Box, we're only able to send to Illinois residents. That's because the provider that we have associated with the program is only able to practice in the state of Illinois. And so if we had providers who could also practice in other states, then that would change the way this works. But right now we've been focusing on Illinois residing patients and clients only. My Lab Box at-home screening panel that we had set up with them consists of an HIV, syphilis, chlamydia, and gonorrhea test. For HIV and syphilis, this is done via dry blood spot collection cards. And so we ship out a dry blood spot collection card alongside with the lancet that will collect the blood. And so a client will self-prick themselves with the lancet, and then they fill up 5 circles on the dry blood spot collection card. And then they'll ship that dry blood spot collection card over to the lab, the lab that we utilize is My Lab Box lab for this service. So the benefit to using the third party is that they ship the kits out and they process it, and then they'll send us the results through the portal. Shipping time can be a bit varied, but this is what we've typically seen: 2 to 3 days for the client to receive the sample collection kit once it's been ordered, and then 2 to 5 days post receiving the kits or sending the kits out to the lab, we'll receive the process results. So this can vary, but it can typically be a pretty quick turnaround. Talk a little bit about how we've adapted our online outreach methods. So before the COVID pandemic, we were definitely using geosocial mobile applications like many nonprofit organizations connecting with MSM or trans women, et cetera. The difference was that we were sending health educators out into community in their own mobile cars with an iPad and a mobile hotspot, and they would connect with clients in different areas to bring them information on at-home prevention, to engage them in our services, or to answer any questions that we had. We also have been engaging on social media platforms like Facebook and Instagram. We've recognized that on Facebook, there's a big benefit to going live. There's also a benefit to going live with multiple people. And so we were able to utilize Facebook for National Transgender HIV Testing Day last year, around April 18th, which was a really great discussion about how people can update their statuses and connect with us in the at-home prevention program, and talk about some barriers that trans folks might engage in, as well as gender nonconforming identified individuals. Later on in the year, for National Latino HIV/AIDS Awareness Day, October 15th, Carlos and I led a panel where we invited community leaders or gatekeepers to be a part of the panel. They shared this live on their platforms as well. And to date, we've been able to receive, I believe, over 940 views. So this was a really great way to engage community as well. Outside of social media and geosocial mobile applications, we engaged with different online article platforms. And so we engaged with the Chicago Reader, the Windy City Times, and we also did an interview with WBEZ Radio. Pretty much after each one of these articles aired or became live, we noticed that there was an influx and increase in requested at-home prevention supplies or orders. So it was pretty recognizable that these methods did work for us.
Right. And now we can jump into a little bit of at-home prevention program data. Here you will be able to see on the right-hand side is a map of when we used to send out the HIV OraQuick screening kits. And so pretty much since we've transitioned over into My Lab Box, we have some data specifically about how those kits are being sent out. We have total, including the ones that have been mailed out, along with kits that were given out in person in the clinic. We have about 377 oral quick kits. To date, we have sent about 10,804 condom pieces, and that includes a variety of what was listed earlier. For lubricants, we have about 9,540. We've also been able to send up to 331 cloth masks. And along with this, we did offer a section of the screening of the request for the screening kits for PrEP navigation referrals. And so we listed out, if anyone was interested in PrEP, if they had, specific questions, if they were interested in being followed up with a PrEP navigator. We offered that option in our intake, and what we did is partnered up with the PrEP team to mail out some PrEP swag with some information, kind of like first steps of how to get started, and a direct contact for a PrEP navigator who is working with our team and our spreadsheets to look at all the patients who come in and make sure that they are being followed up with. For my lab box specifically, since we transitioned, we've had about 165 kits that have been requested. About 81 have been completed, and that includes 73 HIV kits, 69 gonorrhea and chlamydia, and 59 syphilis. So this information here is specific to the patients that have been serviced through my lab box and completed with their orders. We have positivity specifically I wanted to highlight. We've been able to locate 8 new cases of gonorrhea and chlamydia infections, along with 4 syphilis cases. And so if you see here, our completion rate is slowly increasing. We are doing follow-ups with all the patients who have received a kit and trying to figure out exactly any barriers that they might be experiencing with submitting their samples. And so this information here was, again, when we were sending out our supplies. This is pretty much the end of last year through the Chicago and Chicagoland area and the Midwest area.
So to reference back to the PrEP services and outreach that we've been doing, like Carlos had mentioned, so there are a few different ways that clients can connect with us to engage in PrEP. And those point of contacts with outreach used to be only in-person outreach screenings, or if we're doing in-person outreach events. With the adaptation of the at-home screening program, or at-home prevention program, which includes screening and prevention supplies, there's different areas where clients can go ahead and connect with us. So when they're filling out these forms, they'll be presented with the question if they know about PrEP. Once they say yes or no to that, it'll ask them if they're interested in engaging in PrEP. Depending on their interest, if they engage with us through at-home screening, then a patient navigator will go ahead and reach out to them afterwards and engage them in their knowledge of PrEP, kind of gauge what their interest is, and then further enroll them into services. This is all done via telehealth with the PrEP navigator. Once it comes to enrolling them in services, we'll bring them in for an in-person client visit at one of our clinics. However, this visit is shortened and it's pretty much labs only. So again, we're trying to reduce risk and exposure time with clients coming in to do visits. If clients go ahead and select this through the prevention supply program or our at-home services, then we would also mail out a PrEP swag kit with some information on PrEP. It's just a nice touch to give a warm handoff. And so we've noticed that clients do engage with us better when we're able to send off some type of kit or like a gift or an incentive for the program as well. And if you did have any further questions about our PrEP team, Janelle Klein is our newly hired on manager of biomedical HIV intervention. And so you can definitely reach out to Janelle at this email here. They use they and fair pronouns and anything respectful. A little bit about program expansion. So we were able to expand our program to start offering the safer injection supplies like Carlos had said. We kind of had pulled back on that. With the pullback on that, we also pulled back on doing safer snorting kits as well, because we were thinking about doing that, or safer smoking kits. And so at this time, that's something that we've discontinued. We'll look at it possibly involving in the future. We, in the very near future, plan to offer at-home rapid pregnancy screening, and so we'll be shipping out some pregnancy tests that clients can utilize in their homes as requested.
And so, yeah, so we have some learning opportunities that we've come across. Some of them at the early onset was data collection and demographic information that wasn't being collected. Again, like we mentioned, we since have modified our intake form to make sure that we are collecting that information. We have had also a delay of folks submitting their samples. When we did kind of like a full suite follow-up of calling every patient, we had a variety of reasons as to why they hadn't. That included they either just had a recent sexual encounter that they wanted to wait and then screen at a later date. They probably either mentioned going to the clinic versus after submitting a request. And so we pretty much want to be more aware of these different challenges moving forward, along with including more options for Zooms and telehealth to conduct these services, because sometimes folks aren't aware of how to do the finger prick, how to do the self-swabbing, and things of that sort. So understanding and offering more Zoom sessions for clients to build that trust and rapport.
I would like to mention also that we did try to launch Zoom sessions towards the beginning when we were doing the at-home or quick rapid HIV test, but clients didn't really show an interest in that. They would often opt out, and so that was one of the learning curves as well, that we recognized that we couldn't collect results via Zoom, which we had originally intended. And so that's kind of why we switched over to a third-party lab, so that we can confirm results and get those in so we can collect that portion of the data. At this point, I think we'd like to open the floor for questions if there's any questions. I do know that one question that was mailed in to us was, how do we pay for the MyLabBox services? We have been able to secure one of our funders to partially support this payment method for these services, but a lot of it is done in kind by the agency, and recognizing that we wanted to ensure that patients are still having availability to services that they weren't able to get during the time of our restrictions of the COVID-19 pandemic. Payment for these services, I would say for a full panel, cost the agency, I believe, about $160. If you're reduced some of those services on that panel, then it could go down to about like $120, $90, etc. So that kind of answers the payment question. Let's see, I saw we have another question that came in. How are clients doing the blood cards? Here in Colorado, we have noticed samples being rejected due to insufficient amount of blood collected. We also have noticed some of our samples being turned around because of insufficient amount of blood collected. And so, fortunately, working with a third-party vendor, they're able to reship out the specimen collection cards. And so then we kind of send some instructions alongside that, let the client know that it was rejected, and provide a little bit further instruction on what we're looking for to ensure that there is a sufficient amount collected. Carlos, do you want to touch a little bit about how that has gone?
Yeah, so pretty much as Tony mentioned, we will supply them with kind of an example of why it was rejected. A small little clip art that shows exactly how the card kind of should look at the end of the sample collection process. And so, yeah, so we have had folks who have had their samples rejected because of insufficient swabs or the cards. So the lab is very generous to make sure that those replacement kits are shipped out immediately. And we will follow up with the patients to make sure that if they need assistance while they're doing it, they can call us when they get the kits, that we can walk them through it. Those are options we also extend after we notice that there was a rejected sample.
We also have a question from Zara asking, did you get any feedback from the patients who tried at-home testing if they preferred the in-person or at-home testing more?
Thank you. Yeah, so feedback is something that we've been trying to work on throughout the beginning of this process. And so towards the beginning, we were shipping out SurveyMonkey links after each client had completed an order to kind of let us know what they thought. We didn't have the best engagement with the SurveyMonkeys, and so we did reissue some point where we sent out like a large email and we received a little bit more feedback. We were able to do some interviews with patients. They did say that they preferred being tested in their home because it provided like a sense of privacy. I know that for some DL clients, it also provided like a sense of power. They were able to take this moment back. They didn't feel like they had to be in a space where they may be recognized or they may be assumed a part of a community that has attached stigma and things like that. And so we did see a benefit in those instances. I do think that we haven't done a complete service to getting client feedback, and we do want to continue to push that initiative. And so in the near future, we might incentivize client feedback to see if we can get a little bit more engagement. But that's what we've received thus far.
Thank you. And I think that question was also posed for Juan Carlos from Whitman.
Yes. So we did actually get feedback from patients and they is interesting to listen Howard Brown as well, because how we can tell not everything fits for everyone the same way. Our patients are actually a little different, and they do like to come in and to get use our facility to do all level of work. So I think that's the reason why we have seen a decline of people getting at-home services since we reopened our doors.
Awesome. Thank you. And I think this question came up during your presentation as well, Juan Carlos, is that how did you go about finding and hiring the social media influencers?
That is a wonderful question. It is a little bit difficult to get to the point. How we approach it is in different ways. Some of those influencers and previous ones, most of them have been are currently patients of Whitman Walker. So we have did an engagement with our medical providers and asked them to recommend some patients that they are working in the community. They have seen they are interested in being an advocate in the community. That's one of the ways. The other ways is doing outreach events with our youth programming. We have identified young people who are very interested in being engaged in those topics. So it is more of the handpicked than posting a job for the actual job.
Thank you so much. If we don't have any more questions, hold on. Let me make sure I get to our last slide. We really appreciate you all specifically talking about how important community engagement and feedback is, and really allowing that to determine how you all provide programming and services to your clients. Again, I would love to thank everyone for joining today, and thank you so much to our great speakers for their time. At the conclusion of this webinar, there is an evaluation, and we're going to use that information, of course, to inform future webinars. As said at the beginning, the recording of this webinar and the slides will be sent out to all those who registered, and will also be on the NCSC website. And with that being said, have a wonderful day, everyone.